Good morning, good afternoon, everyone. I'd like to welcome you to the webinar today. Thank you for joining us. My name is Joanna Skinner, and I'm the Family Planning Technical Team Lead for the Breakthrough Action Project, which is led by the Johns Hopkins Center for Communication Programs. Before we get started, I just wanted to go over a few logistics. The majority of today's webinar and slides will be in English with simultaneous interpretation into French. One presentation will be in French with simultaneous interpretation into English. Before we start the webinar, everyone needs to select a language option. Please look at the bottom of your Zoom screen and locate the globe icon that says Interpretation. Please select your preferred language, English or French. If you are choosing French, you can click on Mute Original Audio if you don't want to hear the English narration in the background. If you are on an Android or Apple mobile device, in your meeting controls, tap the three dots, then tap Language Interpretation. Choose English or French. If you select French, please toggle Mute Original Audio if you don't want to hear the English narration in the background. A few additional logistics. The webinar is being recorded and we will share audio and slides. All participants will be on mute for the webinar. Please also turn off your video as this will help those with lower bandwidth. There will be time for Q&A at the end of the presentation, so please add your questions to the chat box at any time, and we'll try to get to as many as we can. Please feel free to add comments or questions in English or French. Before turning over to our moderator for today, I'd just like to share some background on this webinar series. In the last 5 years, the family planning community has had renewed energy to prioritize family planning and national health strategies and advocate for increased funding for family planning through development and implementation of costed implementation plans. Despite this commendable and coordinated effort, in many cases, there is still a lack of coordination and prioritization of social and behavior change, or SBC, for family planning. Unfortunately, this has resulted in duplication of efforts in some cases and critical gaps in others. As such, Breakthrough Action, which is USAID's flagship SBC project, has worked with numerous donors, coordinating mechanisms, and implementing partners to develop and validate a global shared agenda for SBC and family planning. The shared agenda, which is available on the project's website and will be posted in the chat box, outlines 5 priority areas for enhanced coordination in SBC and FP. Improving SBC for service delivery, supporting social change for family planning, understanding and meeting the needs of youth, increasing coordinated investment in SBC for family planning, and a focus on Francophone West Africa. Over the course of 2020, Breakthrough Action is hosting several webinars to further the discussion around each of the global shared agenda priority areas. Each of these webinars is being recorded and posted on the project website, so please visit the site to listen to our previous sessions. I will turn over now to our moderator for this webinar, Janet Holt from the William and Hewlett Foundation, who will introduce us to today's topic. Over to you, Janet.
Great, thank you, Joanna. Good morning, good afternoon to everyone. I'm Janet Holt. I'm a program officer at the William and Flora Hewlett Foundation based in California in the United States. I work in our International Reproductive Health Grant-Making Program, and it's an honor to be with you all today. Today's webinar, the 4th in the Shared Agenda series, is focused on the priority area of understanding and meeting the needs of young people in family planning. For many adolescent girls, pregnancy and childbearing are associated with significant health risks, especially in low and middle income countries, where 20,000 girls under age 18 give birth every day, and pregnancy-related complications are the leading cause of death among girls aged 15 to 19. Social behavior change, SBC, plays an essential role in addressing not only individual behaviors related to family planning for young people, but also the social determinants that influence those behaviors. Furthermore, increasing the number of youth-driven programs and meaningful youth partnerships, improving the quality of SBC programming in response to youth needs, and strengthening advocacy with decision makers and influencers to support family planning for youth are all critical components of improving the reproductive health of young people. Governments and donors are paying increasing attention to youth family planning needs. For example, youth are a population of focus in the majority of FP 2020 country costed implementation plans and annual action plans. And donors have made significant investments in youth-focused SBC programming and are working to identify new and innovative approaches in both SBC research and implementation. At the Hewlett Foundation, we've made multiple investments in SBC for family planning for young people, One has been a strategic partnership between Marie Stopes International, MSI, and the design firm IDEO.org, which has explored ways that MSI can improve their youth SRHR services through centering the needs of young people. Human-centered design begins with the client, the young person in this case, and asks them what they want from their SRHR services. By centering young people in all their complexities, MSI and IDEO.org have produced multiple innovative new ways to deliver services that fit the needs of young people in Zambia, Kenya, and the countries of the Sahel. We have learned that HCD, human-centered design, offers a unique way to gather user insights that make services more attractive, accessible, and delightful for young people. We have also invested in a partnership with Camber Collective, also a partner with Breakthrough Action, to explore the use of national segmentation to gather insights and better understand the different outlooks that family planning users maintain. In Benin, this research was focused on young people in partnership with the Ministry of Health and resulted in a set of tools and recommendations that were immediately incorporated into their latest costed implementation plan of Benin. What we know is that young people are not monolithic. Even if you know their demographics, their age, their education level, their socioeconomic status, programs, clinicians, and funders cannot and should not assume what drives their decision-making. Instead, programs must start by centering each young person, asking them what they want and need and what would help them to achieve their reproductive goals. Doing this results in better family planning outcomes, more lasting behavior change, and more agency for young people. So in today's webinar, we will hear from three speakers. First, Oury Kamissoko, Regional Consultant and Merci, Mon Héros Country Coordinator, will present on storytelling as a way of personalizing and expressing youth needs. She will also talk about how to make co-creating for youth and technical staff meaningful, using examples from her work with Merci, Mon Héros and other projects. Next, Daisy Mwilima, Deputy Programs Manager at Copper Rose, Zambia, will present on advocacy for SBC in Zambia, the prioritization of adolescent pregnancy and the Zambia costed implementation plan, and SBC for youth. Lastly, Michalina Drejza, Director of Research and Development at International Youth Alliance for Family Planning, will present on empowering young people by putting the power to achieve directly in their hands and overcoming challenges and partnerships between youth and technical staff. There will be time for Q&A at the end of the presentations, so please add your questions to the chat box at any time, and someone will be monitoring them with you. So make sure you have your correct language selected in Zoom, English or French for your preference. And Oury, over to you to kick us off.
Ok, bonjour à tous. Je suis Oury Kamissoko, je suis consultante régionale sur la campagne Merci, Mon Héros. Je suis basée au Mali, tout précisément à Bamako. Diapo. Next. Aujourd'hui, je vais vous parler de la puissance de la narration et de la co-création pour exprimer les besoins des jeunes et faire pression pour le changement social de comportement. Next. Donc, en introduction, on sait aujourd'hui qu'en Afrique francophone, un grand nombre de jeunes filles ont les premières relations avant l'âge de 19 ans et une partie non négligeable avant 15 ans. Les adolescentes sont souvent en situation de grande vulnérabilité en termes de droits en santé de la reproduction. Et ces besoins restent largement non satisfaits avec des conséquences très importantes sur le développement économique, social et politique des différents pays africains. Next. En général, lorsque nous faisons des études, lors de nos études, quels sont les obstacles que nous voyons qui sont à l'accès aux services de SR chez les jeunes? Le premier obstacle, c'est les normes sociales. Ces normes sont des obstacles relatifs à l'environnement social. Il y a une crainte d'être stigmatisé, les jeunes ont peur d'être jugés, critiqués ou rejetés par la société. Nous avons l'opposition de la famille ou du partenaire. ce qui peut amener des sources de tension, des sources de conflits dans la famille. Nous avons également le poids des leaders religieux et coutumiers, ce qui pèse encore sur les jeunes et qui en grande partie favorise les normes sociales. Et on a un manque d'auto-efficacité chez les jeunes. Nous avons également les obstacles liés à la méconnaissance. On a une insuffisance d'informations claires et inadaptées. Le fait que les jeunes n'ont pas d'informations claires sur les méthodes de contraception, donc les rumeurs qu'ils entendent ou les informations pas correctes qu'ils trouvent de gauche à droite font qu'ils ont une crainte des effets secondaires des méthodes contraceptives. Et ce qui conduit à une absence totale de connaissances sur la santé de la reproduction, sur les différentes méthodes de contraception qui existent et les différentes cécité. Donc, nous avons également les obstacles liés à la qualité des services, c'est-à-dire que les prestataires de santé ne sont pas assez formés pour répondre aux besoins des jeunes. Nous avons les prestataires de santé ont une attitude hostile envers les jeunes. Les jeunes trouvent que ce n'est pas trop confidentiel. On a également les obstacles liés au coût des méthodes contraceptives pour un jeune, pour un adolescent. Si on prend aujourd'hui les coûts des méthodes contraceptives dans nos pays, c'est vraiment très cher pour un jeune pour qu'il puisse se procurer de ça. Et on a également l'ouverture, les horaires d'ouverture des centres de santé qui ne sont pas du tout appropriés aux jeunes parce qu'en général, les jeunes vont du matin jusqu'au soir à l'école. Donc, à la descente vers 17h, 18h, ça trouve que également les centres de santé sont en train de fermer. Nous avons également des obstacles pratiques. Ces obstacles pratiques, c'est les centres de santé ne sont pas adaptés aux besoins des jeunes. Les infrastructures des écoles sont inadaptées à l'hygiène menstruelle. On a un problème de prix des serviettes hygiéniques. On a des infections dues aux toilettes de l'école. On a un accès insuffisant ou même limité aux produits d'hygiène menstruelle. Donc ici, on constate que il y a une peur dans le cœur de chaque partie prenante. Il y a la peur dans le cœur des jeunes, dans le cœur des adultes, des prestataires de santé, de parler des sujets liés à la santé de la reproduction. Et on a une peur des jeunes de poser des questions. Et donc, tous ces facteurs influencés par les normes sociales contribuent à la méconnaissance et à l'inadaptation des qualités des services offerts aux jeunes. Next. Donc, aujourd'hui, pour dépasser toutes ces multiples barrières liées aux besoins des jeunes, liées à l'offre des services aux jeunes, nous avons aujourd'hui la campagne Merci, Mon Héros, qui est en ce sens aujourd'hui un excellent exemple de narration pour exprimer les besoins des jeunes en matière de santé de la reproduction. Ce qu'il faut savoir de la campagne, c'est que c'est une campagne qui est co-créée et qui est co-dirigée par les jeunes avec le soutien du projet Bring Action et financé par l'USAID. Donc, Merci Mon Héros, c'est une collection d'histoires orales qui met l'accent sur le pouvoir des relations interpersonnelles et de l'empathie pour améliorer la santé de la reproduction des adolescents et jeunes en Afrique francophone. Donc, la campagne encourage les jeunes à parler de leur réalité, à célébrer les alliés. Les alliés, c'est les parents, les sœurs, les amis, les partenaires, les prestataires de santé, les travailleurs d'ONG qui ont parfois brisé les tabous pour soutenir les jeunes. Donc, lors de notre campagne, nous encourageons le public, en particulier les adultes, à se reconnaître dans les histoires des jeunes et à dépasser les normes sociales et de genre restrictives pour parler de la santé de la reproduction avec les jeunes. Donc, nous inspirons les adultes afin qu'ils brisent les tabous autour des sujets liés à la santé de la reproduction des jeunes et permettent aux jeunes de raconter leur vécu au quotidien à travers des histoires personnelles et vraies sur un moment sensible de leur vie où un héros les a soutenus sur peut-être ces sujets peuvent être des premières règles, la communication parent-enfant, les rapports précoces, les grossesses précoces, les grossesses non désirées. Voilà. Donc, en somme, nous utilisons les témoignages. Merci, Mon Héros utilise les témoignages car c'est mieux de voir, d'écouter, de sentir et d'entendre les jeunes parler de leur vécu à travers le storytelling qui est l'une des meilleures manières de capter l'attention, de susciter de l'émotion, créer de l'empathie surtout, et surtout stimuler les désirs du changement social de comportement. Donc ici, vous pouvez voir en bleu les hashtags que nous utilisons, hashtag Merci mon héros, hashtag briser les tabous. Pour suivre la campagne, vous avez juste à cliquer sur ça et mettre ça et vous allez pouvoir suivre la campagne. Et là, vous avez le lien de notre page Facebook qui est là, qui aujourd'hui, on partage toutes les informations avec les jeunes sur la santé de la reproduction, sur la communication, qu'est-ce qu'il faut faire, qu'est-ce qu'il ne faut pas faire. Et inciter beaucoup les parents surtout à vraiment communiquer avec les enfants. Next. Donc, pour atteindre notre cible, nous utilisons les technologies de l'information et de la communication à travers les réseaux sociaux, Facebook, Twitter, Instagram, pour toucher le maximum de jeunes à travers des histoires publiées sur la page. Nous utilisons également les mass médias, les télés, les radios pour toucher les jeunes et également les adultes et permettre aux populations qui ne sont pas sur les réseaux sociaux d'avoir des informations et entendre la voix des jeunes. Nous faisons également des activités communautaires afin d'être en contact direct avec les jeunes et les adultes. Ces activités sont en général des conférences, des dialogues communautaires, des causeries éducatives, des causeries grains, afin d'aborder les sujets sur la santé de la reproduction. Next, voilà. L'approche et les buts de la campagne. Nous voulons vraiment capter l'attention des jeunes, capter l'attention des parents, mettre un visage sur les défis parce que c'est toujours mieux de voir un visage, c'est toujours mieux que les gens sachent. Voici un jeune qui a traversé pendant une période de sa vie tel problème et voici aujourd'hui, si nous ne faisons pas ça, voici les conséquences qui peuvent en dérouler. Nous voulons également susciter de l'émotion, créer de l'empathie pour que les parents puissent voir à quel point les jeunes souffrent dans leur coin. Mais aujourd'hui, les jeunes ne savent pas comment s'exprimer. Donc, c'est vraiment créer de l'empathie, susciter de l'émotion auprès des parents pour qu'ils puissent briser les tabous, pour qu'ils brisent les normes sociales autour de la santé et de la reproduction et discuter avec les enfants pour ensuite stimuler le désir du changement social et du comportement. Donc, ensemble, nous encourageons les jeunes à parler de leurs expériences, nous encourageons les adultes à écouter les jeunes à partager les défis auxquels ils sont confrontés, les adultes à soutenir les jeunes en brisant les tabous et également exposer les problèmes ou les questions sur les sujets de la santé de la reproduction qui empêchent les adultes, les jeunes de parler, de discuter ensemble. Next. Donc là, nous avons un exemple d'histoire, qui est l'histoire de Fanta, que vous pouvez retrouver sur la page Facebook de la campagne Merci, mon héros. C'est Fanta, lorsqu'elle a vu ses premières règles, malheureusement, elle n'a pas reçu la bonne information de la part de sa mère qui lui a dit « Si un homme te touche, tu tombes enceinte ». Et en Afrique, c'est cette information que la plupart des jeunes, même moi, que nous avons reçue de la part de nos parents, plus précisément de notre mère. Donc, Fanta, quand elle est allée à l'école, lorsqu'un garçon l'a touchée, elle a directement paniqué et elle a commencé à crier. Alors, c'est là que son prof de biologie s'est approché d'elle, lui a demandé qu'est-ce qui n'allait pas et elle a expliqué l'histoire. C'est là que le prof de biologie alors lui a donné des informations correctes et complètes sur ses menstruations. Donc, on peut dire que c'est à cause de tous ces tabous, de toutes ces normes sociales qui existent que la mère de Fanta ne lui a pas donné les informations correctes sur les normes. Donc, c'est de vraiment encourager les parents à briser les tabous, briser les normes sociales, discuter avec vos enfants. Sinon, les informations qu'ils auront dehors, de gauche à droite, ne sont souvent pas de très bonnes informations qu'ils vont avoir. Next. Donc, les étapes vers le changement pour les alliés, pour la toute première des choses, c'est vraiment d'écouter les jeunes, écouter les jeunes. Ensuite, c'est de comprendre les défis des jeunes sur la santé de la reproduction, sur la planification familiale, les souhaits des jeunes, la sensibilité des jeunes. Et également, les alliés, vous devez reconnaître votre rôle pour intervenir, pour soutenir les jeunes avec compassion et empathie, surtout l'empathie que nous mettons en avant, qui est vraiment très important. Et il faut parler avec les jeunes sur la santé de la reproduction, il faut les fournir les bonnes informations, il faut les encourager, il faut continuer à discuter avec eux et vraiment sans les juger, sans jugement, car c'est vraiment très important. Et c'est par toutes ces étapes aujourd'hui qu'on pourra aller vers le changement social de comportement. Next. Donc, le message qu'aujourd'hui, je voudrais faire dire aux jeunes, c'est de vous exprimer vos besoins, chercher à vous informer, faites de vos parents vos alliés, faites de vos partenaires des alliés, des prestataires de santé, allez vers les centres de santé, n'essayez pas de chercher des informations qui parfois sont erronées. Faites de vos parents des personnes qui ont vraiment les bonnes informations, allez vers eux. Et si les parents ont du mal à briser les tabous, vous également faites-le. Et le message que j'ai aux alliés également, c'est de discuter à bas âge avec les enfants, de trouver des moments idéaux pour discuter avec votre enfant, être à l'écoute sans jugement, c'est vraiment très important. Ne pas avoir de sujets tabous, donner les informations claires et fiables aux adolescents et aux jeunes. C'est vraiment très important que les alliés puissent être là, puissent discuter avec les enfants depuis à bas âge, parce que c'est depuis à bas âge que vous construisez une carapace entre vous et votre enfant. Donc, si cette carapace se développe au fil du temps, l'enfant aura du mal à vous approcher. Et lorsque vous allez approcher l'enfant pour pouvoir discuter avec lui, ça sera super compliqué parce qu'en ce moment, il y aura un tabou, une peur, une honte qui sera là, qui est déjà implantée. Donc, ça sera vraiment difficile pour l'enfant également de se dévoiler, de discuter avec vous. Next. La co-création. Les conseils pour les jeunes professionnels, c'est vraiment de reconnaître que vous êtes des experts. C'est vraiment très important. Les jeunes doivent reconnaître qu'ils sont des experts, qu'ils peuvent être également des mentors pour des adultes professionnels. Les jeunes doivent être ouverts à l'apprentissage de nouvelles choses et au perfectionnement de vos compétences. Soyez ouverts, soyez disponible pour apprendre de nouvelles choses, soyez vraiment perfectionniste, c'est très important. Il faut également faire connaître vos besoins, les besoins techniques, les besoins en matière de rémunération, c'est quoi vos intérêts. Depuis le début, c'est vraiment très important de pouvoir dire tout ça avant de commencer un travail. Il faut être super professionnel, respecter les délais, être responsable, être diplomatique, être courtois et surtout être respectueux, c'est très important. Demander des précisions quand vous ne comprenez pas quelque chose, demander à avoir des informations et demander à avoir un cahier de charges clair lorsque vous commencez à travailler avec les adultes professionnels.
Okay, Oury, we have just one more minute. Please finish.
Et également, ok, pardon, je finis tout de suite. Les conseils pour les professionnels les plus âgés, c'est d'être clair et raisonnable avec vos demandes, inviter les jeunes à donner leurs idées et apprécier l'expertise technique des jeunes, être un mentor, être ouvert à l'apprentissage, traiter les jeunes comme des professionnels et non comme des bénévoles. Donc, c'est un peu ça que je voulais aujourd'hui partager avec vous en termes de co-création, en termes de besoins des jeunes en matière de santé de la reproduction. Et également, j'espère que les personnes qui sont ici vont vraiment entendre la voix des jeunes, vont entendre les besoins réels des jeunes et sauront maintenant comment est-ce qu'on doit maintenant agir avec les jeunes. Donc, pour ne pas trop durer, il me restait juste une minute. Merci, je reste disponible pour des questions, pour des informations ou pour des incompréhensions. Merci.
Okay, merci beaucoup, Oury. Thank you very much. I think that's great. I particularly love the last comment about treating youth as experts and reminding youth to see themselves as experts. I think that's great. So now we will turn to our second panelist, Daisy Mwilima, the Deputy Programs Manager at Copper Rose, Zambia. Over to you, Daisy.
Thank you, Janet. May I have the first slide, please? Okay. So in terms of prioritization of adolescent pregnancy in Zambia's country implementation plan, there's been FP or family planning services have been repositioned as a key driver in development and providing targeted or easily accessible and accurate information to the population, and more effectively target and serve adolescents and youth with quality, accessible sexual and reproductive health information and services for in and out of school young people. So I think key examples for what some of these things are, there is a comprehensive sexuality education curriculum that has been developed for in and out of school young people, where people are taught about their sexuality based on how old they are, what grade they are in, or where they find them, whether it's in the community or in the school. Next slide, please. So in terms of the country implementation plan for Zambia, while we have made quite great strides in advancing family planning, since the first year of the costed implementation plan, the country is not likely to achieve its 8-year scale-up plan. So our scale-up plan was running from 2012 to 2020. So we're ending this year because focus has largely been on investing in trainings and service deliveries and commodities, but no investment has been made in family planning SBC up to and including the 7th year of the scale-up plan that was last year. And up to date, no investment has been made. And this is very common, actually. It's not just for family planning, even in HIV, even in the HIV sector, or generally in the Ministry of Health, there isn't much investment in SBC. I think there's less than 1%. All the other investment goes towards service delivery. Next slide. So the country implementation plan does not really show any allocation for social behavior change. There are no activities that have been implemented for family planning social behavior change in Zambia that is based on the country implementation plan. Also just to mention that although as Ministry of Health partners or civil society organizations and non-government organizations, we do quite some work in terms of social behavioral change communication, it hasn't really been labeled as such, and it just hasn't been outlined as such. But in terms of the country implementation plan itself, there haven't been any activities implemented in that line because there's no money for it. And the unmet need for family planning is currently at 27%, while teenage pregnancies are at around 28%, currently at 29%. Next slide, please. So much as partners have kind of been advocating for social behavioral change interventions passively, I think it became more active when we worked through action through the advocacy subcommittee of the National Family Planning Technical Working Group, which they belong to, began advocating for the formation of an SBC task force to focus solely on SBCC as a core component of getting people to actually utilize family planning. So in June 2019, as partners and Ministry of Health, we had a meeting or a workshop that was supported by Breakthrough Action, and the partners really that were there were from the advocacy subcommittee to explore the possibility of developing an SBC task force. And I think it was at this meeting that that was decided, and a presentation was later made to the entire technical working group, and the task force was formed and it's been in operation since. We've had a number of meetings to just talk through what are some of the ways we could use to actually engage, whether it's donors and the ministry as well, to understand what are some of the key reasons why there is need for us to have budget lines for SBC work in Zambia. Next slide. So yeah, so despite not having social behavior change communication explicitly planned for in the country implementation plan, Zambia, through the Ministry of Health and other cooperating partners, has really made some strides, like I mentioned before, in incorporating and improving social behavioral change work. So we have so far come up with a social behavioral change strategy to guide SBCC work. And the strategy aims at addressing family planning uptake among young people aged between 15 to 19 years for greater impact. And also the strategy draws from the reproductive, maternal, newborn, child and adolescent health and nutrition communication and advocacy strategy, which runs from 2018 to 2021 and is in line with the National Health Strategic Plan for National Health Adolescent Strategic Plan for 2017-2021. So it details and amplifies the issues that face adolescents and focuses on how CPR can be increased for this segment of young people. Next slide. So the question we ask ourselves is, why social behavioral change communication in the first place? So we recognize that without social behavioral change communication, clients won't know the benefits of using contraceptives because they just met at the hospital. So the only time that a client comes to get a contraceptive is perhaps after they've been pregnant and they're seeking whether it's an abortion or they've given birth, and then the provider tells them there's need for them to have a contraceptive to prevent the next pregnancy. And also without investment in SBC, family planning users, both current and potential ones, won't be empowered to rule out myths and misconceptions. So especially among young people, they chat a lot, and there's a lot of myths and misconceptions around family planning. One of the most common ones that I hear in the field is family planning makes young people barren, or it breaks their hip bones and stuff like that. So those are very common things that you hear when you go in the field. So if there are no deliberate efforts for social behavioral change communication, young people will continue to believe these myths and misconceptions, which they hear among each other, but also from misinformed adults, and they won't be able to dismiss those myths and misconceptions. Thus, there will not be like any, they won't be utilizing the services because of the misconceptions that they carry. So also social behavioral change communication will create demand for contraceptives and help them to be valued and appreciated. So as much as people get to know about family planning methods, what's available for them, what are some of the side effects, the accurate ones, and they get to breast some of the myths and misconceptions, chances are that we are going to create demand for the contraceptive methods that we have. And also people are going to be able to value more and appreciate the family planning more that they get. Next slide, please. So in terms of SBCC channels that we use in Zambia, for us as Corporate Zambia, and for most organizations that deal with social behavioral change communication, it's firstly peer education discussion manuals and discussion guides development and distribution. So there's a number of manuals that have been developed for peer educators, or sometimes they're called teen connectors, or young people that are found at healthcare facilities. And these are also printed out and distributed, firstly during trainings, but also even just within their centers for them to be able to orient one another. There's also community dialogues, guide, and material support that's usually done. We also do a lot of interactive community radio programs, especially now with COVID-19. Most of the work around SBC is around community radio programs, because that's like the easiest thing to do and not have like a group of people in one place. Also, another thing that we would normally do is community theater training, creating the community theater training manuals, but also having the community theater trainings within communities. Next slide, please. Other channels that are used are parent-child communication support guide. So sometimes it's very difficult for parents to have conversations with especially the adolescent, because they feel like they're too young. So there are guides or manuals that are prepared for them, and those conversations are hard with parents, in as much as we have conversations with young people, just to ensure that they do understand the need for them to actually have those open conversations with the young ones. And also there are school health clubs, activity guides, including development and rollout of the comprehensive sexuality education, which I talked about earlier for both in and out of school young people. So yeah, you can see from the visual there that some of the activities that we do, as in going into the schools for social behavior change communication on family planning. There's also youth-friendly graphic materials that are normally printed out and distributed in places, stuck on billboards or at facilities on the notice boards and those types of things. Next slide, please. So in conclusion, social behavioral change has improved family planning uptake in different countries, and integrated programs that include social behavioral change can be successful and will improve uptake of contraceptives for the reasons I earlier mentioned. Next slide, Janet. So what are some of the, in terms of the recommendations that the social behavioral change communication task force that has made so far through their meetings is to, firstly, we need to go beyond just posters and leaflets to talk with clients about family planning. So there's need to do more than just doing posters and leaflets, because sometimes people can read these posters and leaflets and still have a lot of questions which they need answers to. So we need to find other creative ways of actually engaging people. Family planning is a continuous health issue and it needs to be sustained over time. Also, we recognize social behavioral change contribution to sustainable impact to change individual communities as well as countries. So for as long as people don't change their perception about issues and about what's going on, it's difficult for you to actually even change anything, because once you leave and they won't be able to, like, they'll still go back to what they thought before. So we understand it's a lot of investment. It takes a lot of time for people to actually be able to change their behaviors and understand things differently, but we have to do it so that at some point this change can actually be sustainable. So social behavioral change can ultimately improve return on investment if more clients are demanding services. So if you have less clients demanding services, we have instances where we have commodities expiring because people did not demand for them, because they are only demanding for a certain type of commodity. So the more people are aware about what services are available, the more you have people demanding for these services, and the more you do not have anything expiring because there was no demand for it. Conversations around gender or HIV should include social behavioral change in family planning in order to strengthen impact. So there's been a lot of advocacy for integrated services in Zambia. So whether that's HIV integration with family planning, as well as other services. And that's one of the things that we think when people are having conversations around whether it's gender or HIV or any other sexual and reproductive health conversations, they should also include family planning, social behavioral change, for us to be able to strengthen the impact. Next slide, please. Also, there's a need for us to really focus on the young people aged 15 to 19. These are in mid-adolescence, and they kind of are exploring at this stage, and they really need that attention. There's also need to finalize the message framework that supports this focus. We also need to create standardized messages that are relevant to adolescents and young people. So sometimes we assume that adolescents are going to, like, take heed of whether it's messaging or advice that we give to them just because we think so. But I think having messages that are actually targeting them as a community and are very relevant to them, and actually engaging them even in the process of developing these messages will be helpful, because then it's literally relevant to them and helpful to them as young people. There's also need to scale up and take forward those interventions that are working for adolescents. So there's already interventions that we've seen working, whether it's by partners that they've implemented before, and Ministry of Health, and we feel there's a need for those to be scaled up and take them forward so that they can continue to, like, work for more young people. There's also need to develop new social behavioral change communication approaches for adolescents, and basic family planning promotion posters at clinics for women who come to health facilities for services, to remind them to continue to use family planning, or if they're not using, to consider using it. Next slide, please. Thank you so much. That's the end of my presentation. I look forward to a question and answer session.
Thank you very much, Daisy. That was great. All right, we're on to our next presenter, Michalina Drejza, who's the Director of Research and Development at the International Youth Alliance for Family Planning. Thank you, Michalina.
Thank you so much, Janet. Good morning, good afternoon, everyone. Thank you very much for the invitation to speak in this extraordinary webinar among wonderful co-speakers. I'm really honored to be able to speak on behalf of my organization, International Youth Alliance for Family Planning. If I can have a next slide, please. I want us to take a step back throughout my presentation and take really a global level to what my colleagues have already mentioned. And I want to just showcase what IYFP really is and the lessons learned that we have throughout our last 5 years of existence, focusing on our country level youth-led initiatives and the global advocacy and meaningful youth engagement work that we have been doing with multiple partners, and also ending with some of the recommendations for the SBC programming. I just wanted to highlight that I have a tendency to speak too fast, so for the interpreter's sake, if I speak too fast, please let me know. I'm going to speak slower. If I can have a next slide, please. Thank you. So I wanted us to start with a quote from my colleague Buju Boskord, who is a co-founder of the organization, that family planning is the key to the future. It's not a privilege or an honor. It is our right. And the rights-based approaches, I think, especially recently, have been resonating throughout the SBC programming, as well as the family planning and reproductive health world. So our network is really committed, and you're going to see it throughout the presentation, that the rights-based approaches are something that we are very, very passionate about. If I can have a next slide, please. So who is IYFP? And the next slide. I just want to briefly say that this mission is still in the working as we are going through the strategic planning work that is going to be done, should have been done earlier, but we all know how COVID-19 have affected our work. So the mission as it currently states is to enable youth from around the world to advocate for their needs and fully lead interventions and decisions on family planning and sexual and reproductive health and rights at home and across the world. And if you see what's on the next slide, we have just recently, last month, concluded the recruitment for the new cohort of country coordinators. And we are proud to say that we are working in 80 countries, and we are going to, for the next 2 years, work with the newly recruited country coordinators that are our core representatives on the ground, as IYFP operates within the global local synergy that I'm going to speak to in a second. That we have executive team on the global level and 80 country coordinators leading work on the ground. Now, on the next slide, I just want to briefly say that we are really a locally led organization, and our model is really to let young people lead on the ground. So it is not the executive team that leads the agenda as such, but the youth that are working at coordinating the country level work on the ground. And the next slide, please. So very briefly on what is the IYFP method. The next slide. We built relationships, and we're really committed that when youth enter our network, either as country coordinator or as executive team members, we don't join just a network, but we really join a family, and we really are passionate about building relationships and friendships that stay for life. We are, of course, being very professional, but we are really, we're really seeing that, you know, building this additional relationship layer to a professional relationship is really something that changes and you know, that is giving the additional motivation. We're all inclusive, and we have youth within our network from everywhere and from every background. And this is something as also a lesson learned, really, because historically IYFP has been funded in 2013 as an outcome of an international conference on family planning in Addis Ababa in 2013. And we really, and I know that folks that have been working in the family planning world see how it all evolved. We historically did not have really all progressive, rights-based or rights-focused and justice-oriented youth, but we also had very, you know, people coming from conservative religious environments who were not as, you know, as easily speaking about sexual and reproductive rights as we can speak about them now, 5 years later. So this is something that we are proud of, but this is something also that the world of family planning needs to kind of check about, like, who is within the networks that we are working in. Should there be a values charter that the organization should commit to? So, you know, it is all in the works, and we're very, very passionate of, you know, building on the lessons learned that I'm going to speak to in a minute. We love to partner, and I see also in the participants list some of the partners that IYFP work with. We work from the ground up, so as I already mentioned, you've set their own agenda. We found youth directly, and really the role of the executive team is to support young people on the ground, either giving them technical skills or really advocating for their funds. And we are non-traditional, and I know that this might sound a little bit cheesy, but we are really believing in the innovation and really letting and trusting young people to do what they think would work in their networks. If I can have a next slide, I just want to mention several locally led projects that have been available due to generous funding from the Gates Institute at Johns Hopkins University. So if I can have a next slide. Our folks from Egypt in 2018 led a services mapping initiative to advocate for sexual and reproductive health service availability and innovative financing to improve care for adolescent and youth refugees in Egypt, focusing on youth in Alexandria. And our Egyptian folks partner with the Federation of Medical Students on the ground to really work close, you know, hand in hand with the health professionals as well. Or the medical students and other healthcare students to really join forces and improve care for refugees in the ground. Next slide, please. Moving down south to Namibia, our coordinators in Namibia led a grassroots organizing initiative in Omaheke and Kavango regions to scale up interventions for the integration of family planning and HIV/AIDS issues for young people on the ground. If I can move to the next slide to far east to Nepal, we launched a program in Kathmandu's primary healthcare centers to evaluate and upgrade knowledge, attitudes, and practices of female community health volunteers on sexual and reproductive health issues. Moving a little bit to the south with the next slide, in Bangladesh, in 2018, IYFP Bangladesh members designed and co-hosted the Bangladesh Third National Youth Conference on Family Planning in partnership with several different agencies, allowing this, you know, country-level advocacy conversations to keep on going. Moving to Africa with my next slide, in Rwanda, last August, IYFP Rwanda sought to address early unintended pregnancies among adolescents and youth in the country by disseminating comic books that you can see the excerpts from in this slide, as they recognize the need to promote access to comprehensive, reliable, clear, and youth-friendly information. Moving west to Mexico with the next slide, IYFP Mexico created and led a training program that certified 20 young people aged between 18 to 25 to be youth counselors. So really peer-to-peer counseling was something that our Mexican chapter was passionate about. Coming back to African region with the next slide to Malawi, IYP Malawi is currently running a program to advocate for and promote the mainstreaming of youth disability rights and achieve an increase by 50% comprehensive knowledge and services on HIV CSE among 1,000 youth. So these were some of the objectives that our country coordinator are setting for every 2 years. And our colleagues from Malawi were very passionate about working with youth living with disabilities. Moving a little bit north with my last example to Congo, IYP Congo led a meaningful, wide-reaching sensitization and education campaign about SRHR throughout various means. Here you can see the peer education classes led by our country coordinators. So you see that there are a lot of going on. I would need to have at least 2 hours to highlight all of the actions that we are doing in the 80 countries that we work with, but I hope that you at least have a little excerpt of what we do at the country level. If I can have a next slide, something that we, and I think that the family planning world in general have been ultra passionate about, which is the digital innovation and using all of the platforms that we are now privileged to have. So here you have an example of a tweet chat that our youth from Kenya have been leading with advocacy messages, creating TV shows, and really using digital tools to provide education, counseling, and promoting awareness. So this is just one of the examples, but just to highlight here that digital world is giving us so much more than we had, last 5 years, even 5 years ago. So putting it here for the further conversation. With the next slide, I just wanted to highlight what we are really passionate about, which is not just global local cooperation, but indeed a synergy. And I think that's especially for the folks who have experience working within global health, quote unquote, it is different than what we are doing at the country level. And there are different rules for funding and different conversations that are happening with donors and different adversities to tackle. So we tend to address it as the synergy, from the synergy standpoint, that really it needs to go hand in hand rather than just a cooperation or a top-down or bottom-up approaches. It really needs to be a synergy indeed. With the next 2 slides, I wanted to highlight something that, as IYFP have been founded in the International Conference on Family Planning, and I'm sure that some of you have been there in Rwanda almost 2 years ago, and we were supposed to meet this year, early next year in Thailand, but COVID-19 got us all surprised, and we needed to adjust. But what I wanted to say is that conferences and international meetings have been incredible opportunities to showcase all of the work that our youth at least have been working on the ground. And we as IYFP have been responsible to organize the youth pre-conference that have been happening at the ICFP 2018. We really implemented interactive workshops, training, storytelling, youth-centered panels across conferences. You see here the photo from the youth plenary that we mirrored a vagina monologues, if you guys are aware of this method of storytelling. We also had a closing ceremony youth engagement with a song. So really different engagement to showcase the youth work at the ICFP. But the next slide, I also wanted to highlight, and I see that some of the folks in the chat, looking at the participants list, have been there. So for the ICPD Plus 2025, we also led UNFPA Pamoja Zone Youth Performances with our project Sex O'Clock News, which is the vagina monologue style storytelling. We led the Youth Advocacy Bootcamp and led several sessions throughout the meeting. Last thing that I wanted to say, to showcase really with the next slide, is our flagship project, which is a 3-year youth advocacy partnership with the Population Reference Bureau and the Bill and Melinda Gates Foundation in Kenya, Uganda, Burkina Faso, Ethiopia, and Nigeria. as we move to the year 3 right now, is this empowering evidence-driven advocacy. So year 1 was all about really seeking evidence and having our youth as research associates to generate evidence and then to drive their own agenda with advocacy objectives being set by the youth on the ground. I'm aware of the time, so I need to move to the next slide, which is yet another example. I know that I'm hitting you guys with examples, and I wish I had more time for that, but we also wanted the country coordinators in the ground to really work within the working interest group, but not the regional, most obvious ways of cooperation, but we had country coordinators working from across the regions on the advocacy areas or the SBL areas that they were passionate about. They were the ones that happened with our last country coordinators cohort was HIV/AIDS, PSE, abortion, child marriage, and menstrual hygiene ones. So moving on 2 slides, if I may, being aware of time, I wanted to move to the recommendations. Yet one more, because I am aware that I have only 30 seconds left. So the recommendations that I wanted to give, living on, having all the lessons learned that I already mentioned, is really let young people lead. And this very cheesy quote, "Nothing about us without us," maybe there's still some folks that need to hear that. If you let young people lead the agenda and really, making them making young people being responsible from the beginning to the end, from the design to implementation to evaluation, it really makes so much difference and a difference, and giving really power in young people's hands. Moving on to my second point, there is a certain difference between the definitions that we are all thinking that we are speaking the same, but they are not the same. And there's indeed a difference between participation, engagement, and partnership with young people. So I hope that we would be able to manage to speak, speak the same definitions when we are saying that we are engaging young people and we're all on the same level on what that actually means. And also something that, as a director of research and development, I am particularly passionate about, is to really generate the evidence-driven advocacy. So really research, conducting research to action for this local global synergy that I mentioned already is the key to provide meaningful SBC programming. I am aware that I am over time, so over to you, Janet. Thank you so much for this presentation. I will be happy to answer any of the questions.
Super, thank you so much, Michalina, and thank you to all of our panelists, Oury and Daisy as well. We're going to go into our question and answer time now. Thank you to those who've already submitted questions in the chat. You may still do so if you have questions, and if you want to indicate if it's for all the panelists or for a particular panelist, that would be appreciated. We're going to begin by a question for all the panelists. In your opinions, what is the most pressing issue that SBC programs should address to improve family planning and reproductive health for young people? So a big issue, a big question. What is the most pressing issue that SBC programs should address to improve family planning and reproductive health for young people? So I will let you decide who goes first. You can come off mute and jump in.
Okay, I can go first.
Thank you, Daisy.
Thanks, Janet. So I think, in my opinion, one of the most pressing issues that SBC should focus on is provider attitude, like healthcare provider attitude. I know most of the time, one of the feedback that you get even from the Ministry of Health is that there's no evidence that providers' attitude stops young people from actually accessing services. But if we're going to do social behavior change communication activities in communities and get young people to actually want to access services, if they do not have good reception while they're at the facility, chances are that they won't go back there and they won't encourage somebody else to go. Meaning all the efforts that people put into the social behavioral change, whether it's money invested, time and everything else, is really going to waste because they don't really, like young people will still not go and access the services. So I think for me, and this is based on personal experiences, it's based on observations, provider attitude is one of the key things that have to be really targeted. So this could start with trainings for providers to make them understand adolescent health, why there's need to focus on adolescents, why it's important for them to not feel judged, why it's important for them to not feel like they're being treated as children and not clients. And that can help really improve family planning utilization and other sexual and reproductive health services utilization. So yeah.
Super. Thank you, Daisy. That's a great answer. I agree. That's a major issue. Anyone else, Oury or Michalina, a pressing issue that SBC should address?
Oui.
Please go ahead.
Pour moi, le besoin le plus urgent des jeunes en matière de PF que les programmes de CSC doivent prendre en compte, c'est vraiment l'accès aux informations claires et fiables et adaptées surtout à l'âge des jeunes. Parce qu'aujourd'hui, on ne peut pas parler d'offres de services si les jeunes n'ont pas les informations, les jeunes n'ont pas d'informations claires et surtout très fiables par rapport à l'offre des services. Parce que tout passe par l'information aujourd'hui. Il faut aujourd'hui que les informations claires et fiables puissent vraiment passer pour qu'aujourd'hui, nous puissions être capables de répondre aux attentes des jeunes. Et si aujourd'hui, nous ne donnons pas les informations claires, nous allons continuer à avoir des grossesses précoces, des grossesses non désirées, de nombreux avortements clandestins avec des risques importants de mortalité. Et aujourd'hui, c'est vraiment pour parler d'offres de services, il faut parler d'abord d'information. Et les jeunes ont besoin de cette information claire, fiable, vérifiable, pour qu'ensuite on puisse les inciter vers les centres de santé pour qu'ils puissent utiliser les méthodes de contraception de leur choix. Merci.
Merci, Oury. Great.
I would go last, last but not least. So I think that there are two really pressing issues. One is to really address the elephant in the room. We are living in the age when we really have difficulties to address. We need to really think interdisciplinary with putting racism, power, privilege, gender equality, and all of these big words to the mix, to be quite honest. And I think that until they are going to be addressed, the innovation will not go forward. So I would say address the elephant in the room and really speak the same definition. There is a certain grade, especially among donors or the adults working with the youth, on what does it mean to work with young people. Certain people tick boxes when they have young person in the panel, but certain people are moving forward and only acknowledging partners, having young people as partners when they are being engaged since the beginning to the end of the project. So I think that it will be very important to move from just a tokenistic approaches to having youth as participants and as recipients purely, to really have them as partners at every level and at every stage.
Great, thank you. All right, so moving to another question for all. We have a question about evidence that supports SBC and improving demand specifically. So this one, you'd be happy to, if you have any favorite evaluation data or pieces of work that you know of that make that connection between social behavior change programming and demand creation for young people, you can either plug it into the chat later, or if you want to speak to it now, that would be welcome. And Joanna also shared a link in the chat to the Breakthrough Action website where you can see a list of studies as well. So does anyone have a favorite evaluation or a piece of evidence from their work or partners? It's all right if not. Okay, we'll wait on that and let our panelists perhaps share some pieces later on. Okay, another question came in for everyone, which is the issue of youth exploitation in global health organizations. It's an issue that's been raised on social media recently, and certainly something that I know many of us have been aware of or talk about. So what do we think of as the use of young people as volunteers? So moving maybe a little beyond what Michalina was speaking about of the tokenism of sort of just having a youth on your group, and having them instead involved from beginning to end as key experts in a program. But what about, you know, not the issue of paying youth for their participation, paying them as experts, and not treating them as volunteers? Does anybody want to comment on that issue?
Yeah, if I might jump here, Janet, I think that I basically just want to say young people need to be paid for their work. And if there would be a sentence that I would love to, you know, leave the participants of this webinar, it would be this. And I think that it is being increasingly better and better. But I think that it is still not, you know, not a new normal. And I hope that it really will be. Because for young people, I think that, you know, there are multiple amazing opportunities to get the skill set, to get the new, you know, meet an incredible people throughout, let's say, global conferences. But all in all, it is about, you know, getting yourself sustained, finishing the degree that you are, you know, because probably if you're between 18 to 25, you're a student. And, you know, if you really want to partner with young people, you would treat them as any other person that you're working with. So really starting with one and finishing with one, young people need to be paid for their work.
Great. Anyone else want to comment on that, or should I move to another question? All right, thank you.
Oui, je pense que c'est un conseil que j'ai abordé dans ma présentation aux professionnels adultes, c'est de vraiment maintenant arrêter de voir les jeunes comme des bénévoles, maintenant de commencer à traiter les jeunes comme les professionnels, comme vraiment des experts, et voilà, par des rémunérations, par des intérêts, par des formations techniques, voilà, pour pouvoir répondre également aux besoins des jeunes qui les aident pour leur atteindre les résultats. C'est de vraiment considérer les jeunes comme des professionnels et non comme des bénévoles. C'est vraiment très important pour réussir une co-création significative. Merci.
Merci, Oury. Okay, thanks. So I have a few more questions. Actually, we have quite a few. I'm just going to try to get to as many as we can. So we do have a couple of specific questions for Oury. So Oury, I'm going to give you a few together. So one is, what age group is Merci, Mon Héros focused on? Another is, how does the interactive radio programming work? And then the last is, how have the Merci, Mon Héros stories and larger campaign addressed sexual consent and other traditional gender norms for young people? How do you work on norms around tricky things like that? So over to you, Oury, for those questions.
Ok, merci pour la question. D'abord, je vais commencer par la première question. Quelle est la tranche d'âge visée par Merci, mon héros? D'abord, c'est la tranche d'âge, c'est que on peut dire que la campagne vise les personnes de tout âge, c'est-à-dire non seulement les jeunes, mais aussi les adultes. Parce que lorsque les jeunes racontent leurs histoires, lorsque les jeunes racontent leur vécu, pour nous, le plus important, c'est que les adultes également puissent entendre ces histoires, puissent se reconnaître dans ces histoires. Et c'est de vraiment créer une empathie une émotion entre les adultes et les jeunes pour que les adultes puissent se dire, ah, les jeunes font face à beaucoup de problèmes et qu'est-ce que nous faisons pour que, voilà, ils puissent s'en sortir pendant cette adolescence, pendant cette période de temps. Donc, c'est pour dire que la campagne elle-même, Merci, Mon Héros, vise tout âge, les jeunes, les parents, les adultes, les prestataires de santé, les travailleurs d'ONG, vraiment toutes les personnes qui peuvent nous aider à vraiment aller vers le changement social, le comportement. Maintenant, par rapport aux radios, qu'est-ce que nous faisons voilà, pour la programmation des radios? Merci, Mon Héros, c'est déjà dans plusieurs pays d'Afrique francophone. Donc, lorsque nous allons à la radio, nous prenons un terme spécifique. Comme exemple, on peut parler de la communication par enfant, on peut parler de l'utilisation des méthodes contraceptives. Donc, c'est de vraiment discuter, communiquer à la radio, donner les bonnes informations, non seulement aux jeunes, mais aux adultes également. Et pour que les gens puissent vraiment se dire que oui, aujourd'hui, il y a un problème. Et si nous n'interagissons pas, si nous ne faisons pas quelque chose, le problème va encore plus s'accentuer et s'atténuer. Donc, c'est un peu ça, ce travail que nous faisons avec les radios. Et très généralement, avec les radios, on laisse également une ligne ouverte les internautes, au public qui nous écoute, pour qu'eux aussi puissent nous poser des questions directement à travers un numéro et nous, on les répond également directement à travers la ligne. C'est vraiment un échange, une discussion, voilà, avec les gens. Maintenant, comment est-ce que les histoires de Merci, Mon Héros abordent la question de consentement sexuel? Là, en fait, lorsque nous racontons les histoires, nous faisons en sorte que les histoires sur les premières règles, le premier rapport sexuel, les grossesses précoces, les grossesses non désirées puissent ressortir. Et par rapport au rôle traditionnel, nous allons également vers les leaders religieux, les leaders coutumiers. Nous, on les appelle beaucoup plus les influenceurs de la campagne, parce que ce sont ces gens-là qui peuvent influencer sur les normes sociales. Donc, que eux aussi, à travers des vidéos, puissent encourager les jeunes, puissent donner un exemple pratique sur leur vie ou une histoire également sur leur vie ou encourager la campagne d'une manière pour que voilà, les gens puissent se dire ah, nous n'avons pas seulement les histoires des jeunes, mais nous avons également des histoires des parents, des femmes qui racontent un peu les violences conjugales et également des histoires des leaders religieux pour qu'eux aussi puissent appuyer la campagne. Donc, pour nous, un peu, c'est des influenceurs. Donc, voilà un peu pour répondre aux 3 questions qui me sont assignées. Je suis toujours disponible pour répondre à d'autres questions. Merci.
Okay, thank you very much, Oury. So we have another question that is probably maybe first for Daisy, but the others are free to also jump in. So we had a question about the integration of SBC programs and service delivery. So the question says that many SBC programs don't have any control or mandate to actually change how services are delivered. Instead, they are sort of separate information campaigns, community campaigns, but not programs that actually change the way that services are delivered. And perhaps that's an important line to be crossed, but it's difficult with funding or mandates inside or outside the Ministry of Health. So how can approaches integrate these 2 modalities and have SBC touch other aspects of family planning besides just community information campaigns? Thanks.
Well, I think part of the things, I imagine this is related to what I was saying about provider attitude. Yeah? Just so I'm clear.
It could be. Yeah, okay. That's a great example. How would an SBC campaign get to that level, you know, actually have the mandate to change how providers deliver services, or what the clinic experience looks like for a young person?
Okay, so I believe when we're talking about social behavioral change communication, it's for the adolescents, yes, but it's also for everybody else that's involved. So I'm not really sure it's limited to young people alone or community people, but it also extends to healthcare providers as well. For example, one of the key things that organizations and Ministry of Health has been doing is conducting trainings on adolescent health service provision for healthcare providers. So that's service delivery, but the trainings are more on how to handle adolescents when they're at the clinic and those types of things. There's also trainings on values clarification and attitude transformation that most organizations, as well as the Ministry of Health, does here in Zambia. And those trainings have a huge impact in terms of how services are delivered when you get to the clinic. Because if a provider is able to clarify between their values as an individual and what the client wants, and that's the adolescent, and stop looking at them as a daughter or son who's come to collect a service, but a client who needs a service, it helps in terms of how they actually even relate and what type of attitude they give the young person when they come to a clinic. So I think it's integrating some of these things in the trainings that are done for healthcare providers, because they do have a huge impact on whether or not the young people are actually going to access services. So that's why I feel like just limiting the behavioral change to the clients themselves and not extending that to the providers of the services is kind of biased. It's a one-way route, and you're not going to get the desired results at the end of the day. So finding a way of getting the providers as well through the various trainings that are available for them to understand, to begin to change their behavior as well in terms of how they relate with their clients is also very important, to like get the desired results that we want and increase family planning utilization. So yeah.
Great,
so I think
you.
then in terms of funding from donors, I think it's then planning. When you're planning for your activities with young people, whether it's radio programming, whether it's printing out of manuals, whether it's community theater groupings and stuff like that, find a way of also planning for a few trainings with healthcare providers. We do a lot of that at Koparo Zambia. So when we plan social behavior change activities for young people in our projects, we also plan for 1 or 2 trainings where we bring together the young people themselves and the stakeholders that we're talking about. So there's those types of conversations going on, hearing it from the actual young people themselves, but also then they begin to clarify their values and kind of begin to work on their attitudes towards young people, because then they begin to understand that it really does have an impact as compared to when you as an individual or an organization go to tell them this attitude is ruining young people's lives and stuff like that. They don't seem to get it that way.
Great, thank you, Daisy. So actually we are at time, so I'm going to wrap us up for today. I'm sorry we couldn't get to all of your excellent questions, but we've captured them, and the slides will be shared out with everyone afterwards. And I hope you can all follow up with each other and keep the discussion going. So you will see on your screen a post-webinar survey, which if you can please just take 1 minute to fill it out, that would be really great. Also, please do read through the shared agenda that's been developed by Breakthrough Action. It was shared in the chat early. And think about how that you can share and discuss it at your organization, how you might be able to contribute to some of the recommendations for this priority on social change focused on youth. So thank you all very much for your time today. And thank you for filling out the brief survey that just opened up on your screen. And I hope you will continue the discussion amongst each other and with your organizations and colleagues. So thank you very much.